This is Jerry again. This is part 2. We just spent a little time treating her, and the only thing we did was we restored anterior glide mobility to the ischium, and it took us 5 minutes. And now this PSIS is no longer prominent. I have to really search for it, and when I take up the slack, it springs nicely. Could you lie on your stomach, please? Her left sacrotuberous ligament was pretty tight. I don't know if I filmed that or not, but the ligament is right here. I think I showed you sacrospinous, but anyway, the sacrotuberous was really taut, and now it feels like normal rubbery, a strong rubber elasticity. The ischium, when I try to spring an anterior glide, take up the slack, spring recoil, and let go, and that has mobility. So it did correct that. Could you lie on your back and we'll show the pube structure. She still feels, I use the term bone energy, and that's going to get me in trouble. I'm not much for this woo-woo energy stuff, you know, but honestly, with my hands, I perceive more tightness over that right pube bone. Okay, well, a soft tissue eval later on would make sense. Okay, right now we're dealing with really dense connective tissues. But we will move forward and screen her iliopsoas and some of the quads and see if we can find out why there's more tension here, and it might be an abdominal muscle as well. But as we walk across the top of the pube bone, the step off is significantly reduced. Okay, and I think it's still very slightly present. Really subtle, whereas before it was really distinct. So I think we'll repeat that treatment right now and see if we can change that. I'd rather send her out the door with that straight. And we did find the compensation, and the compensation made perfect sense. The compensation was C1 was rotated right and side glided right, and the occiput participated in that pattern. I call it a type 1 pattern. It does about 6 different things that I don't need to elaborate on right now. I think we're going to close this now. The main thing I wanted to demonstrate was how the pube shift relates to the SI. The primary problem was not the SI restriction, it was actually the symphysis pubis restriction, which responded very well to 5 minutes of viscoelastic creep using a fulcrum or low load long duration stretch. Thank you.